Dr. Privitera, there's been some controversy around the use of generics in the treatment of patients with epilepsy. Is there any new information to guide clinicians?
Yes, so there's been a lot of concern about the use of generics in epilepsy. A number of different studies have been published wondering whether seizures might get worse, side effects might get worse when people are switched from brand to generic drugs. The FDA's position is that they do very rigorous testing, and all their testing verifies that these generics are equal. So several years ago, a group of us from the AES got together with the FDA to try to say what kind of studies can we design to really answer some of these questions. And after several years, we were able to work with FDA. So a combination of funding from FDA, the American Epilepsy Society, and the Epilepsy Foundation allowed us to start and do 3 different studies, 2 of which are now complete. These studies looked at, one of the things that the FDA does is the testing of generic drugs is based on single-dose studies in normal volunteers. So our main question was, if you do those same studies in people with epilepsy taking the drug every day and taking other drugs in addition, not just like the healthy volunteers who weren't taking other medicines, would that induce variability in these generics that might explain some of the problems? So we've now completed our first study in patients with epilepsy taking lamotrigine, and much to our surprise, we demonstrated that the 2 generics that we tested against one another were very, very close, and really don't seem, at least based on that study, does not seem to create a lot of risk for people with epilepsy. An independent study was done at the University of Maryland, a similar design, although they tested the brand versus one specific generic drug, and those 2 came very close. We also have a 3rd study that's still ongoing. It should be done sometime in 2015, and that study looked at single doses, just because for some pharmacokinetic reasons, a single dose study may be more sensitive to detect differences. So unless that 3rd study shows a big difference, our conclusion so far is that maybe generic switches aren't as dangerous for people with epilepsy as some people had thought. We're not saying that people don't have problems with generics, but there may be other issues. For example, there was a very interesting study performed and published in JAMA that indicated when people get different generic drugs and the pills are different shape or different color, that they may have less compliance. And it makes sense. If you're 70 years old and you're taking 6 different medicines, a blue pill, a pink pill, and 4 white ones, and you go to the pharmacy and you come home with 2 blue ones, a pink one, and 3 white ones, you might get mixed up as to which pill is which. And that may be part of the problem, that some people are just getting mixed up when they get different shape or color generics and not taking their medications right.
Is there any reason to think that if we looked at more generic medications, say of lamotrigine, that there would be differences, random variation between them greater than you observed in the comparison that you conducted your study for?
We chose lamotrigine because it's one of the ones that had a lot of complaints, and we, across the 3 studies, we've looked at 3 different generic manufacturers of lamotrigine. So we're pretty confident that looking at different manufacturers may not show anything. Although there is a caveat, and that is when lamotrigine first went generic, there were about 11 different companies that came out with generics. As time goes on, that shrinks down. There's, from probably business reasons, a company decides, gee, we don't want to make epilepsy generics anymore. We just want to stay with blood pressure medicines or something like that. So maybe some of the more variable generics are already off the market when we started our study, so that's a possibility. But the other part of your question is very important as well, that we just looked at lamotrigine, and maybe some of the other drug generics aren't as performing as good, although we were pretty surprised at how tight these generics were, that even if we saw much more variability in other drugs, they probably would still be within the range that would appear to be safe.
Okay, thank you.
Thanks.